So I started by introducing myself to the patient, confirming my patient with name and date of birth, and then asking for consent to work with her. I did ask about any contraindications like fractures, recent surgeries, joint instability that I should know about before getting started. For passive range of motion, I supported the lower extremity into hip abduction, watching for that external rotation at the hip, and then stepping back myself to avoid rotating my trunk with my own body mechanics. Same goes for active range, just watching for that external rotation. I had her do active range again, side lying for my gross strength assessment before applying pressure to make sure she was at least a 3. My pressure was at her lateral knee joint, mid-mod max, into adduction, and she was a full 5 out of 5. For my goni measurement, I did have her remove her pants, which she was comfortable with, just so I could have better visualization of the joint, lining up my fulcrum with the ASIS on the ipsilateral side, the contralateral ASIS for the stationary arm, and then the movable arm follows that anterior midline of the femur. I had her do it actively first to see what she could do on her own, and she was about 40 degrees of hip abduction. Our normal is 0 to 45, so I did want to take her again passively just to see if I can get her any farther. And again, just watching for that external rotation of the hip. I'm also stepping back with this one as well, making sure I'm not rotating my trunk for my own body mechanics, and I was able to get her to that 45-degree mark. For the muscle lengthening, for the iliotibial band, I did the Ober's test, so I put her on her contralateral side, and then I had her bend her non-tested leg so that it widened her base of support and it was more comfortable for the patient that way. Passively took her tested side into hip abduction and slight extension, and then lowered her leg down to the table. Normal findings would be the thigh being parallel with the table, which hers was. For manual muscle testing of glute medius, I did keep her on her side. I wanted to make sure she could do the motion first, so I brought her into hip abduction, extension, and external rotation. Asked her to do that movement on her own before I put any pressure on her, and then pressure was going on that lateral lower leg, mid-mod max, and she was a full 5 out of 5. For sartorius, this one's a little tricky. It was hip and knee flexion, external rotation, and abduction of the hip. I had her do the motion first, and then using 2 different forces, kind of a counter force, to try and push her out of all 4 of those positions in the opposite direction, making sure I'm not pushing directly on the sartorius muscle. For the special test, I did Trendelenburg test, so I had her stand on the side we were testing, making sure her hip wasn't dropping to indicate any glute med weakness.